So, imagine you're an ICU doctor. You're standing right in the middle of a hospital ward.
Right. The fluorescent lights are humming, machines are beeping.
Exactly. And you're holding a clipboard, just staring at the actual physical patients in the beds right in front of you.
The real data.
Yeah, the real data. But then you look up at the television on the wall, and the Minister of Health is standing at a podium.
Oh, man.
And he's telling the entire country a story about who is in those beds.
Yeah.
But the numbers he is shouting to the nation, well, they simply do not match the clinical reality you are literally documenting on your clipboard.
Which is a terrifying disconnect.
It really is. And today's deep dive is all about what happens when that first draft of history collides head-on with raw, unedited medical data.
Yeah, because we are unpacking a really massive, incredibly detailed analysis from a Dutch YouTube broadcast called Dwarskijkers.
Dwarskijkers,
Yeah.
which translates loosely to what? Contrarian viewers?
Yeah, contrarian view, or like people who look at the official narrative from a cross angle. They're fact-checking the official story.
Right. And to set the stage for you listening, this broadcast features a data analyst named Maurice de Hond, a presenter, and crucially, Dr. Jona Walk, who is an internist and a vaccine researcher.
Right, and they're actively dissecting the official testimony of the former Dutch health minister, Hugo de Jonge.
Who is testifying under oath, right?
Yeah, exactly, under oath, before a parliamentary corona inquiry committee.
And, I mean, a parliamentary inquiry is supposed to be the ultimate accountability mechanism for a state.
It's the official process where a government investigates itself, basically, to figure out how a crisis was managed. It writes the historical record for future generations.
So the stakes here are immense. When a former minister testifies under oath, you expect absolute factual clarity.
You do. But the sources we are looking at today are openly accusing the former minister of perjury.
Wow. Perjury, lying, and actively spreading disinformation during that testimony.
Right. But we should be really clear here. Our goal today isn't to play judge and jury on the legality of his testimony.
No, definitely not. We aren't taking a political side.
We're going to look strictly at the friction point between the two opposing narratives. The political rhetoric presented at the podium versus the granular day-to-day hospital data these medical experts brought to the broadcast.
Okay, so let's unpack this, because the most explosive collision between those two realities begins with a phrase that honestly dictated global policy for months.
The pandemic of the unvaccinated.
Yes. During his testimony, the minister stated under oath that the vast majority of hospital patients were unvaccinated.
He cited figures between 80 and 90%.
Right. And he used that specific statistical claim as the foundational justification for keeping the country under strict societal measures.
He was arguing that the unvaccinated were entirely responsible for the impending collapse of the healthcare infrastructure.
But Dr. Walk brings forward her own localized data from her hospital in Nijmegen to counter that narrative.
And she tracks the numbers across a very specific timeline, which is key.
Right, because in August and September of 2021, she noted her hospital saw a split of roughly 40% vaccinated patients to 60% unvaccinated.
Which sort of leans toward the minister's narrative initially?
Initially, yeah, but the data takes a sharp, undeniable turn starting in October 2021.
The ratio completely inverted.
Wait, completely?
Completely. From October onward, her ward was seeing between 60 and 70% of the COVID patients being fully vaccinated.
Wow.
Yeah, the on-the-ground reality settled at roughly 65% vaccinated, leaving only 35% unvaccinated.
So that creates a massive canyon between the minister's 90% political claim and the 35% clinical reality Dr. Walk was documenting on her clipboard.
Exactly. And the sources on the broadcast don't just rely on one regional hospital to make this point.
Right, they build a broader national timeline.
Yeah, to demonstrate that the minister's awareness of this shift was just unavoidable.
And they highlight a really specific moment involving Peter Omtzigt. He's a prominent Dutch
Yeah.
politician, right?
Yeah, he's renowned for his rigorous forensic dossier research, very detail-oriented.
So on January 4th, 2022, Omtzigt tweeted a screenshot of a comprehensive report from the RIVM.
Which is the Dutch National Institute for Public Health and the Environment, basically their CDC.
Okay, so this RIVM report laid bare the national numbers for December 2021. And what did it reveal?
It revealed that 75% of the individuals contracting the virus during that period were fully vaccinated.
75%. So the timeline contradiction is the absolute crux of their argument against the minister.
Yeah, if a member of parliament is openly tweeting the State Health Institute's own data showing a 75% vaccinated infection rate in early January,
Then the Minister of Health is mathematically boxed into knowing the 80 to 90% unvaccinated hospital claim was outdated? Or just outright false?
right, testifying years later that hospitals were overwhelmingly burdened by the unvaccinated during that specific winter period, it just completely ignores the state's own data showing the inverse trend.
And Dr. Walk points out that the RVM's finalized retrospective hospital data aligned much closer with her 65-35 split.
Nowhere near the minister's staggering number.
Right. Now, if you're doing the math in your head right now, as you listen to this, you might be thinking, wait a second.
Yeah, the base rate fallacy.
Exactly.
Yeah.
You might think if 85 or 90% of the entire adult population gets vaccinated, won't they naturally eventually make up the majority of hospital cases? Simply because there are so many of them.
Yeah, it's a common psychological trap.
Think about the mechanics of a seatbelt law. If a state mandates seatbelts and 95% of drivers comply,
Then when you look at the emergency room after a massive highway pileup in a blizzard.
the vast majority of the people arriving with car crash injuries are going to be people who are wearing seatbelts.
But it doesn't mean the seatbelt failed to protect them.
No, it just means the pool of unbelted drivers is so incredibly small that even a high injury rate among them produces fewer raw bodies than a low injury rate among the massive pool of belted drivers.
And that phenomenon, that statistical illusion, is known as the base rate fallacy.
And the human brain struggles immensely to process it, right? Especially during a crisis.
Oh, absolutely. We are evolutionarily wired to focus on the absolute numbers right in front of us.
In this case, the raw number of vaccinated patients filling up the hospital beds.
Right. What we fail to visualize is the denominator.
The sheer size of the vaccinated population out in the real world.
Exactly. A vaccine can provide a massive relative risk reduction for an individual, making them far less likely to need hospitalization.
But if millions of people take it, the tiny fraction of individuals who still end up hospitalized will eventually outnumber the total hospitalizations from the rapidly shrinking unvaccinated group. Okay, so Dr. Walk, being a researcher and an internist, obviously understands the mechanics of this base rate fallacy.
Oh, she definitely does. The broadcast isn't arguing that the vaccine didn't work to reduce severe illness.
Right, their grievance is entirely focused on the weaponization of the numbers.
Yeah. The minister allegedly utilized the raw, misunderstood fear of overcrowded hospitals to paint a terrifying, simplified picture for the public.
By claiming 80 to 90% of the beds were taken by the unvaccinated, he was creating a scapegoat narrative.
To maintain public compliance with lockdowns, rather than explaining the nuanced mathematical reality of a highly vaccinated population.
It's a choice, right?
Yeah.
To use a simplified, fear-based narrative instead of treating the public like adults who can understand a mathematical denominator.
And that choice had severe consequences when the government turned its attention to the remaining holdouts.
The remaining 15%.
Right. The minister testified that the remaining 15% of the population who hadn't taken the shot posed a looming apocalyptic threat of thousands of new hospital and ICU admissions if they were infected simultaneously.
I mean, when a national leader throws a word like thousands at a public that is already exhausted, economically drained, and terrified of a collapsing healthcare system.
It provides a very strong psychological mandate for extreme measures.
But Dr. Walk applied a brutal microdata reality check to that specific doomsday scenario.
She used her November 2021 hospital spreadsheet.
And this blew my mind. During that month, with national vaccination rates hovering between 70 and 80%, her entire major regional hospital in Nijmegen saw a total of 132 COVID patients.
And out of those 132 patients, only 41 were unvaccinated.
Okay, so we take that baseline of 41 unvaccinated individuals in a month.
Right.
If the government's entire rationale for intense societal pressure was to eliminate that specific burden, let's run the hypothetical.
Let's read it.
What if the state deployed the ultimate forced vaccination scenario and compelled every single one of those 41 people to get the shot?
Dr. Walk calculates that exact theoretical outcome using the scientific consensus on vaccine efficacy at that specific moment in time.
Which was what?
The medical literature indicated roughly a 50% efficacy rate against hospitalization for the variants circulating then.
Okay, so applying that 50% reduction to the 41 unvaccinated patients reveals that absolute, Universal compliance would have prevented approximately 20 admissions in her hospital.
Over the course of the entire month.
20 beds.
Yeah. We go from a national political rhetoric warning of thousands of admissions crushing the infrastructure
Down to an on-the-ground reality of freeing up fewer than one bed per day in a major regional facility.
The math of the doomsday scenario just instantly falls apart under clinical scrutiny.
Which illustrates the profound danger of epidemiological modeling that stays trapped in macro-level percentages, right?
Oh, completely. When policymakers only look at theoretical worst-case scenarios from a national vantage point, the sheer scale makes almost any intervention seem justifiable.
But when you apply a rigorous cost-benefit analysis at the micro level, weighing the massive societal damage of mandating a minority population against a net gain of 20 beds a month, the policy looks wildly disproportionate to the actual, measurable threat.
And the disconnect between the podium and the ward becomes even more alarming when the broadcast pivots to the infrastructure of the Corona Access Pass.
Right, known as the CTB in the Netherlands.
Yes. This was the digital system requiring proof of vaccination, recovery, or a negative test just to walk into a restaurant, attend a theater, or participate in public life.
So what's the timeline issue here? Because the timeline the minister provided for the creation of this pass contains a detail that sources found deeply incriminating.
During the inquiry, the minister casually noted that the ministry began conceptualizing and building the architecture for the Corona Access Pass in March of 2021.
March of 2021. Why did Dr. Walk flag that specific month?
Because the global scientific community had virtually zero actionable data on whether the vaccines prevented viral transmission at that point in time.
Wait, none.
None. The initial clinical trials that dominated the news were explicitly powered to measure symptomatic disease and severe outcomes like hospitalization and death.
So they were not designed to continuously hunt for asymptomatic spread.
Exactly. So if the state is building a societal blockade based on the premise that vaccinated people don't spread the virus.
They are building it on an assumption, not a clinical trial.
Right. And Dr. Walk details the singular exception available in the literature back in March 2021, which was the AstraZeneca double-blind randomized controlled trial.
Now, a double-blind RCT is the gold standard of scientific evidence, right? Because neither the researchers nor the participants know who received the vaccine and who received the placebo.
It eliminates massive amounts of human bias.
So in this specific trial, researchers swabbed the participants' noses every single week, regardless of whether they felt sick, actively searching for the virus.
They weren't waiting for people to cough, they were hunting for silent carriers.
And what did the gold standard trial find?
It found no statistical difference.
None.
The asymptomatic viral carrying between the vaccinated group and the unvaccinated placebo group was essentially identical.
Wow. Yet the minister claimed under oath that the vaccine provided 60% less spread.
Yeah, and the sources traced this 60% figure back to subsequent observational studies.
Which Dr. Walk argues were structurally incapable of proving that number due to confounding variables.
Because an observational study has a fatal flaw here, right?
Yeah.
You aren't controlling the environment in a lab.
Right, if you observe that vaccinated people in the real world are spreading the virus 60% less, you can't definitively credit the biological mechanism of the vaccine. You have to account for human behavior.
Exactly. Vaccinated individuals in early 2021 might have been far more risk-averse overall.
They might have worn higher quality masks, actively avoided crowded indoor spaces, or tested themselves more frequently before socializing.
And if a study cannot control for those specific behavioral differences, it risks attributing a reduction in transmission to the vaccine when it might actually be driven by sociological caution.
It is similar to standing in a city, noticing that people carrying umbrellas get wet less often, and publishing a study concluding that umbrellas project an invisible magical force field that repels water from the atmosphere.
That's a great analogy. You're completely ignoring the confounding behavioral variable, which is that people with umbrellas also tend to stay indoors or seek awnings when the rain starts.
The umbrella is a marker of cautious behavior, not a magic force field.
Right. Furthermore, even if one were to accept the premise of those flawed observational studies, the broader epidemiological data rapidly dismantled the narrative anyway.
Because of the real-world data coming out of highly vaccinated nations.
Yeah, places like Israel and Qatar, massive data sets demonstrated that any initial marginal protection against transmission vanished entirely by the 6-month mark.
Which is where the legal and ethical foundation of the Corona Access Pass just implodes.
Completely.
If the pass was introduced to the public in September 2021 and massive data sets already proved that transmission protection waned rapidly, the justification vanishes.
Because legally, the state could not implement an access pass merely to coerce citizens into raising the vaccination quota.
Right. The sole legal and constitutional justification for restricting fundamental freedom of movement was the mitigation of transmission.
So building the system when there was no evidence it stopped spread, and launching it when there was definitive evidence the protection vanished, renders the policy fundamentally baseless in the eyes of the sources.
You know, the frustration with this timeline discrepancy led Dr. Walk to offer one of the most illuminating analogies of the broadcast.
Oh, the spark plug analogy?
Yes. It's a moment of profound, relatable frustration. She described the visceral reaction of a medical professional listening to a politician explain science to an inquiry committee.
It's brilliant. She compared the minister's testimony to listening to someone confidently announce, "I'm going to change the spark plugs in a diesel engine."
Right, because to anyone who doesn't work on cars, that sentence sounds entirely professional. Engines need maintenance. Spark plugs are a real car part. It all sounds perfectly authoritative.
But a mechanic hears that and instantly knows the speaker has zero foundational knowledge.
Because diesel engines operate entirely on compression. They do not have spark plugs.
Exactly. And the specific medical error that triggered this analogy was a moment where the minister seemingly mashed two entirely different epidemiological concepts together.
He correctly stated that the vaccines make an individual less sick, thereby reducing the burden of severe symptoms.
But in the next breath, he argued for the necessity of reaching a high vaccination rate to achieve group immunity, drawing a direct comparison to the measles vaccine.
Okay, let's break down the mechanics of group immunity, or herd immunity, because it's a term that got thrown around constantly without a mechanical explanation. How does a vaccine actually build a herd immunity firewall?
Group immunity is a strict mathematical threshold that relies entirely on a biological mechanism called sterilizing immunity.
Sterilizing immunity. Meaning what exactly?
It means the vaccine doesn't just reduce the severity of the cough, it completely blocks the virus from replicating in the host, and it prevents the host from transmitting it to the next person.
It physically breaks the chain of transmission.
Yes. The measles vaccine provides sterilizing immunity. So if a high enough percentage of the population has that firewall, the virus literally runs out of viable hosts to jump to.
Starving the outbreak, basically.
Right, and indirectly protecting the unvaccinated minority hiding within the herd.
But a vaccine that merely blunts the severity of symptoms for the infected individual does not sever the transmission chain.
No, the virus still enters, replicates, and jumps to the next host, even if the current host feels totally fine.
Therefore, from a purely mathematical standpoint, a symptom-reducing vaccine cannot generate group immunity.
It's mathematically impossible. Whether 50%, 90%, or 100% of the population receives a symptom-reducing shot, the virus continues to circulate.
It protects the individual taking it, but it provides no systemic firewall for the group.
The minister was hunting for spark plugs in a diesel engine.
He was trying to build a public policy around achieving herd immunity using a biological tool that was physically incapable of producing it.
And the sources on the broadcast don't view this as a simple, clumsy slip of the tongue by a politician doing his best.
No, they view it as a foundational, catastrophic lack of understanding that drove punitive national policies.
Which forces the big question, is this an example of staggering bureaucratic ignorance? Or is it a calculated, intentional messaging strategy designed to manipulate public behavior?
And that question of intent brings us to the ethical climax of the broadcast.
Yeah, this gets intense.
The inquiry committee repeatedly pressed the minister on the underlying motivation of the Corona Access Pass. They wanted to know if forcing the population to get vaccinated was the primary hidden objective behind locking people out of society.
And the minister vehemently denied that coercion was the primary goal.
He categorized the massive increase in vaccination uptake using a very specific Dutch word, neveneffect.
Which translates to a highly desirable side effect.
Right. He argued the primary goal was safety, and the resulting spike in coerced vaccinations was just a happy secondary outcome.
Maurice de Hond, the data analyst, responded to this semantic defense with a staggering, visceral analogy based on the principle of double effect.
The machine gun analogy.
Yes. He said, imagine an individual walks up to a neighbor's house with a machine gun and unloads into the living room, killing everyone inside.
Okay.
When the shooter is dragged into court and confronted with the murders, he tells the judge, My primary goal was simply to destroy their ugly front window. Their deaths were not my primary objective, they were just a highly desirable side effect.
Man, it is a brutal visual, but it really forces a massive debate on the philosophy of intent versus predictable action.
Can a policymaker claim ethical innocence for a severe, highly predictable consequence of their policy simply by labeling it a secondary goal on a piece of paper?
The medical experts in the broadcast argue that such a defense is ethically hollow.
Dr. Walk testified to the reality she saw on the ground. She watched patients who had made deeply considered, thoroughly researched medical choices against taking the vaccine ultimately capitulate.
They didn't change their minds based on emerging clinical data.
No, they surrendered because the state engineered a daily logistical nightmare that made basic survival exhausting.
They had to subject themselves to constant invasive testing just to go to their jobs, play in a local sports league, or sit in a cafe.
The state built a wall of friction so high that compliance became the only path back to a normal life.
But let's look at this through the lens of modern political science for a moment. Because governments craft policies to nudge citizen behavior constantly.
Sure, all the time.
They implement tax credits for electric vehicles, or they levy heavy sin tax on tobacco. Nudge theory, championed by economists like Richard Thaler and Cass Sunstein, is built on the idea of making undesirable choices more expensive or annoying without banning them outright.
Right.
So when does a bureaucratic nudge cross the invisible ethical boundary into outright coercion?
Well, the sources argue the boundary is defined by the arena the policy enters.
Okay.
A tax on cigarettes involves commerce. A medical mandate involves bodily autonomy, which is governed by a completely different ethical framework.
Because in medical ethics, the foundational pillar is informed consent.
Exactly. For consent to a medical intervention to be legally and ethically valid, it must be granted freely, completely devoid of systemic duress or coercion.
So a financial penalty on a pack of cigarettes is a nudge.
But systematically locking a citizen out of societal participation, threatening their livelihood and their mental well-being, unless they submit to a medical injection that is the definition of systemic duress.
Under the weight of the Corona Access Pass, the sources argue that true informed consent basically ceased to exist in the Netherlands.
The minister's use of the phrase highly desirable side effect is viewed by the speakers as a cynical attempt to wash his hands of an immense ethical breach by hiding behind bureaucratic semantics.
And the tragedy of that systemic duress is that it wasn't exclusively weaponized against the general public.
No, not at all.
The broadcast heavily details how this same architecture of pressure was actively applied to medical professionals who dared to analyze the data differently.
Yeah, during his testimony, the minister made incredibly disparaging remarks about critical doctors.
He dismissively referred to them as people in white coats spreading disinformation.
And he even questioned whether groups like the Artsen Collective, the Doctors Collective, were actual medical practitioners.
Which, as a highly credentialed internist, Dr. Walk found deeply offensive.
I mean, these were not random internet commentators. These were experienced specialists and researchers.
Labeling them as simply people wearing white coats was a deliberate, calculated tactic to strip them of their professional authority in the eyes of the terrified public.
But the state didn't stop at rhetorical insults on television. The minister admitted during the inquiry that he engaged the IGJ.
The Health and Youth Care Inspectorate.
Yes, the powerful oversight body for medical professionals in the Netherlands.
And he didn't just casually ask them to monitor the situation.
Right.
Yeah.
No, he explicitly demanded that the IGJ take visible action against doctors deviating from the state narrative. He wanted the punishment to be public, specifically targeting organized dissenting groups.
And we get to see the mechanics of this intimidation firsthand through Dr. Walk's personal experience, illustrating exactly how a chilling effect operates within an institution, even without an official sanction.
Right, because she never received a formal reprimand letter from the inspectorate.
But third parties, individuals who were not her patients, just random citizens who saw her speaking critically about the data in the media, would write aggressive complaints about her.
And the critical component is where those complaints were routed.
Right.
These strangers wouldn't just email Dr. Walk, they sent these complaints directly to her hospital employers. And they would CC the Minister of Health, prominent politicians, and the IGJ on the very same email.
Imagine the psychological toll of that environment. You go into work, you do your rounds in the ICU, and your hospital management receives an email from a stranger declaring you a danger to public safety, with the National Minister of Health copied on the correspondence.
The administrative pressure placed on hospital management to quiet their doctors becomes overwhelming.
And that administrative pressure was backed by a nuclear threat. Politicians were standing on the floor of the parliament, on national television, openly calling for dissenting doctors to have their medical licenses revoked.
In the Netherlands, this is the big registration.
And the big registration isn't just a certificate on a wall.
No, losing it means you lose your entire career. Your ability to practice medicine, your livelihood, the culmination of decades of rigorous study entirely evaporated.
Dr. Walk described a harrowing moment where a supervisor approached her, clearly distressed, warning her that her big registration could be targeted.
And the supervisor wasn't questioning her clinical skills. The supervisor was reacting to a political climate that had made it abundantly clear that scientific dissent would be punished with professional execution.
The sources characterize this dynamic not as a chaotic byproduct of a mismanaged crisis, but as deliberate psychological warfare.
A chilling effect is a well-documented tool in organizational behavior and state control.
A government does not need to fire every single dissenting doctor to manufacture consensus.
Exactly. They only need to visibly threaten the careers of a few prominent voices, and the rest of the profession will instinctively self-censor out of self-preservation.
The broadcast argues this was a conscious strategy, likely guided by behavioral psychology units within the government, to silence the clipboard and elevate the podium.
It represents a terrifying rupture in the fundamental trust society places in science.
Right, because if the public assumes doctors are agreeing with a policy because the clinical data supports it, but the doctors are actually only agreeing because they are terrified of losing their medical licenses,
then the public isn't following science at all. They are simply following raw, unquestioned political power disguised in a lab coat.
which brings the broadcast to a furious condemnation of the Fourth Estate, the media.
The media is supposed to act as the firewall between unchecked state power and the public.
Yet the sources express sheer disbelief at the mainstream media coverage of the inquiry. Journalists were sitting in the public gallery listening to the minister claim 90% of hospitals were filled with the unvaccinated, or attempting to explain herd immunity through symptom reduction.
And instead of immediately fact-checking those mathematical and biological absurdities, the journalists simply acted as state stenographers,
Paraphrasing the minister's quotes into their evening reports without an ounce of friction.
When the media fails to bridge the immense gap between the complex, on-the-ground reality and the simplified political rhetoric, the rhetoric wins by default, leaving the public completely in the dark.
And the failure of the media sets a dark precedent, which is probably the most alarming takeaway for the experts on doorskikers.
Yeah, at the conclusion of his testimony, the minister reportedly expressed zero reflection or regret, stating he would do things the exact same way again.
And more concerningly, he advocated for a future command and control structure for managing crises.
A command and control structure means total top-down centralization of power.
Right. In a future emergency, the Ministry of Health would possess the ultimate authority to dictate medical protocols directly, entirely overriding the localized individual decisions of ICU doctors.
The political apparatus would eliminate any room for debate from the white coats actually standing on the floor.
It's taking the guy who doesn't know how a diesel engine works and making him the supreme, unquestionable head mechanic for the entire nation.
And because the institutional media abandoned their forensic duty to challenge this encroaching structure, the individuals involved in the broadcast have taken the responsibility upon themselves.
Right. They are dedicating their entire summer to compiling a meticulous, line-by-line, data-driven fact check of the minister's testimony,
which they plan to submit directly to the Parliamentary Inquiry Committee to ensure the historical record isn't written solely by the state.
They have also built a dedicated platform for this project, coronaquit.nl.
And recognizing the critical importance of public access, a sponsor, Zero Water, stepped in to cover the operational costs, entirely removing the paywall.
So they are fighting to ensure that this historical fact-checking effort is freely available to anyone willing to look past the political narrative.
It's an incredible effort.
It really is. The journey we've taken through this source material highlights something fundamental. There is a vast, often deeply uncomfortable gulf between the paternalistic, streamlined stories we are fed during a national crisis and the complex, messy mathematical reality of the underlying data.
It demands that we continually look for the base rate fallacy in everyday statistics.
It demands we hunt for the confounding variables when presented with observational certainties.
And it reminds us to check if the engine we are looking at even takes spark plugs before we let a politician tear it apart. You know, we rely on parliamentary inquiries to write the first draft of our history. We entrust them with establishing the truth for future generations. But if the testimony given under oath by powerful figures directly contradicts the hard data collected on the ground by practitioners, and the media actively refuses to investigate that contradiction, who actually gets to write the history we remember?
That is a question we all need to be asking. Thank you for joining us on this deep dive. We'll catch you next time.